So we are here with another live streaming session. So we have taken the topic Oet Speaking Simplified. So I will wait a couple of minutes so that all others can join.
Yeah.
So Needu ma'am, hello. Good morning, Arvind sir. Jija Babish, good morning.
Hi, Christy ma'am.
Hi Ashwati. Hi Naresh, good morning. Hi Fessy ma'am. Vipin sir, good morning.
Good morning, Aishu. Good morning, Steffi.
Good morning Deepthi.
Good morning, Sharon. Hi, Kirti.
Hi Basil. Good morning Prasida ma'am. Good morning Arya.
Good morning, Varsha.
Good morning Lijesh. So once again, good morning to all. We have already discussed regarding the topic Oet Speaking Simplified. So from the name itself, you might be aware that we are dealing with Oet speaking subtest today, right?
Yes, sir.
Okay, so we'll be starting with the criteria for Oet speaking. So we will give a brief overview regarding the criteria and followed by a small discussion regarding the warm-up questions. I know everyone will be doubting regarding the warm-up questions. So after that, we will have a small session regarding the tips and strategies for the Oet speaking and followed by our role play at the last. So I think that is our plan for today, right?
Yes, Alvin, sir. So this is our plan.
So before we begin, I would like to share a very happy news with all of you guys because we had our December 17th Oet results published yesterday, and I'm really proud and I'm really happy to say that we have received a very tremendous results this time. So I'm really happy about that, and I would like to share some videos regarding our winners and our results. So we'll just have a look on that. So that was regarding our Oet results, and I am really proud about these victories. So what do you feel, Varna?
I feel so happy because we really have a great result.
Yes.
Am I right?
Yes, and it was our first result in the year 2023, and we had such a great beginning.
Yeah, and we really scored really great marks. Not just 350. We have a lot of students passed the exam with a good marks, and we are really feeling proud and happy for this score.
Yes, and it's really great to hear that. And before then, without much delay, we will begin with our topic. So once again, our topic is Oet Speaking Simplified. So from the topic itself, it is really evident that we are going to deal with Oet speaking subtest. So what is your vision, or what is your impression regarding the speaking subtest? Is it easy, or is it tough, or is it moderate? So what do you think?
For me, according to my personal opinion, Oet speaking is a very easiest module comparing to the rest of them, and we have certain criteria to be followed, and it's a very simple task to complete, and you can really score with a great or better score in Oet speaking if you're following the criteria in a good way.
Yes. So just for an instance, if you're receiving a same grade, I mean not up to a B grade for more than 2 times, that doesn't mean that you are not able to speak or you are not able to clear the Oet speaking subtest. So there will be some very minor points that we have to be careful about to crack the speaking subtest, and we will try our best to provide you with those tips and strategies, right?
Right, and the most interesting part is you just have only 5 minutes to complete the task, and there will be half of the minute will be taken by the interlocutor, right?
Yes.
So you can easily complete the task with full-on confidence, and we have a small structure for that. But it doesn't mean that you should follow this, but it is a better way to complete your task without any difficulty.
Yes, so we are providing such structures for each and every subtest in order to prevent more risk from happening, so that we will be able to get more scores or higher scores within our comfort zone. So that is why we are providing such structures, and we know that for Oet speaking we are doing role plays, and we will be taking the role of a nurse, and our interlocutor will be taking the role of a patient or perhaps the relative, right?
Right.
Yes.
You are absolutely right, Alvin sir. And we have certain settings and different tasks. We have to speak to the patient or bystander, or sometimes we have to speak with the parents, and we are dealing with certain settings, and we can really connect with the natural settings in the hospital itself.
Yes, so we are in a conversation from the time itself we begin our Oet speaking. So we are in a conversation, so we have to start a conversation, we have to build a conversation according to the settings, and we have to keep moving on according to the conversation, and finally we should have a conclusion to the conversation. So it is not like a monologue, or it is not like a lecturing session. So it is a conversation. So you have to keep this point in your mind, that we are in a conversation, because when you hear about speaking, so many of you will think that the more I speak, the more I will get good grades. So it is not only like that. The patient involvement or the patient participation is really important in case of role plays. We know that we are doing role plays, and patient participation is really important.
Yeah, that's what make Oet speaking different from IELTS speaking.
Yes.
Yeah, because we are dealing that what Alvin sir said before, we are dealing with a certain conversation. So try to give a space to the trainer or interlocutor to speak out.
Yes.
That's the best way to complete your task without any difficulty.
Yes, because we are a nurse and we are talking to a patient.
Yeah.
So our patient, or even if it is a patient or it is a carer or a caregiver, I mean, or a bystander, they will have many concerns to share with us. So that is one of the main quality of the nurse also. We have to be a good listener.
Yeah, exactly. It's a best point you should keep in mind. You should be a good listener.
Yes.
And because you can really connect with the task if you are listening in a good way.
Yes.
And definitely the interlocutor gonna give you certain points regarding the next task.
Yes.
So try to give a space to speak out, and try to repeatedly ask the concern of the interlocutor or the patient or the bystander. This is the easiest and the best way to complete your task in the criteria form.
Yes, so exactly. So we will continue with such tips and strategies at our coming session. So we will begin with the criteria for speaking. So we know that there are mainly 2 criteria for speaking, that are
The first one is linguistic, and the second one is clinical communication criteria.
Yes, so from the name itself, it is really understood that linguistic criteria is something which is related to our language, that is English. So linguistic criteria, there are 4 sub points under linguistic criteria, and all those things deals with how we speak and how efficiently we handle the language English, right?
Yes.
Yes, and coming to the clinical communication criteria, so again from the name, I have already told that we are doing, or we have a setting which is related to clinics, I mean a hospital.
Yeah.
So clinical communication criteria assess those things which are more related to a nurse or
Yeah.
which profession that you appear.
Belongs to.
Yes. So shall we begin with linguistic criteria?
Yeah, sure. you
Yes.
can.
The first one that comes under linguistic criteria is intelligibility. So that is the first thing that you have to keep in your mind. So what do you mean by intelligibility, Varna?
I think it's all about the pronunciation.
Yes, the impact of your pronunciation. So is pronunciation very necessary for speaking, not only for OET, but pronunciation? I think pronunciation is really important for speaking, right?
Yeah, right. Then only we can understand what the patient or what the bystander is talking about.
Yes.
So if you are talking in a too much sentence or the words, if it is not clear, we really can't answer the question. Am I
Yes,
right?
yes.
So that's why we are telling that pronunciation, the first criteria, is really important.
Yes. So along with pronunciation, we have intonation and accent. So
Yeah.
intonation means our sound, or the sound we speak, not the magnitude, or the not the magnitude of the sound, but the kind of tone we are into this speaking subtest, and also accent, definitely, because we have seen many students trying to fake
Yeah.
on their accents and trying to speak as foreign speakers. So that is not at all necessary. Just stick on to your native accent by which you speak. So that is
Yeah.
really understandable for all the others, right?
Yes, and Alvin sir, I just want to mention something regarding over here.
Yes.
We are using our natives into English.
Yes.
It's actually really bad when we listen to that. Like some kind of words, like we are leading the words into some kind of our native slang. Like
so that comes under intonation also, because we may be from different areas of our country. So each and every areas have a different kind of language, I mean the tone of language. So please don't try to mix up those particular tone into your professional English accent. Yes.
Yeah.
But just try to speak normally. Okay, try to make it simple.
I think we're done with the first.
Yes. So what is the next criteria?
The next one is about the fluency. So from the fluency, it is very clear that it's all about the speed and the smoothness of your speech. But it doesn't mean that if you're speaking in a too good way or speed, it's not the fluency.
Yes.
But please do make sure that the listener is able to understand your speed. Try to bring the speed in a minimum and be relaxed while you're speaking. Right?
Yes. So whatever thing that we present, or whatever thing that we speak, has to be easily understandable for the listener. So that is our main aim. So I have already told that we are in a conversation. So while we are building a conversation, the patient has to be clear about the things that we are saying.
Yeah.
Okay.
Right.
So that is the importance of fluency in OET speaking. Okay, so after that we'll come to our third criteria, that is appropriateness of language. So appropriateness, all these criteria comes under the main thing, that is linguistic criteria. So regarding appropriateness of language, so the impact of your language, the tone and the professionalism matters.
Yeah.
So we are doing a formal speaking, right? Yes, we are talking to a patient like a conversation, but we are a nurse. Okay, so we are a professional. So there should be a sense of professionalism in the speaking.
Yeah.
Yes.
I think when we are giving a correction to our students about the tone or voice modulation, they are not able to understand.
Yes.
What we are expecting, try to understand the settings and try to understand the rhythm of the scene. Okay,
Yes.
that we are dealing with. So you can easily change your tone according to that. Okay, if the patient is saying some kind of concern, your pitch of your sound will be low, and if you're giving some kind of appreciation, the pitch will be high.
Yes.
So these are the voice modulation or the tone we are expecting.
Yes.
This is all about the third criteria.
That is appropriateness of language.
Language.
So the fourth one is?
Resources of grammar and expression.
Yes.
So Alvin sir, is grammar is really important in OET speaking?
Yes, most probably, because grammar is first of all important in English language first of all, and when it comes into OET speaking, grammar is also somewhat important.
Yeah.
Because I'm saying that I'm in a doubt, because I told we are in a conversation. So the each and everything that we speak, our main aim is to be to provide more clarity to the listener.
Yeah.
Okay, so if you make more and more grammar mistakes, sometimes it may be difficult for the listener to capture the things.
Exactly.
So that is why grammar is a bit important at the time of OET speaking.
But we can easily reduce our grammar mistake, because we have only less amount of words to speak out.
Yes, because from our role play card, you might have seen a role play card or a cue card, that consists of many clues and many sub points. So we just have to construct a proper sentence.
Yeah, right.
Yes.
So shall we move to the second criteria?
Yes. So the second criteria, or the second set of criteria, was clinical communication criteria, or how we maintain our professionalism in a clinical setting.
Yeah.
Yes. So the first one is
relationship building. This is the first one, and from the word or from the criteria itself, it is very clear that I already mentioned. Please do give a space to the patient or the bystander whom you are talking to. Because it is really important to give a space or priority to speak out. Then only you can get the data from the person.
Yes. So I think being nurses, it is really easy. I mean, it will be more convenient to meet clinical communication criteria than linguistic criteria, because, as I told, we are nurses.
Yeah.
So from our first criteria, relationship building. So this is the main thing that we usually do in our day-to-day lives as a nurse, because whenever we first go to a patient, the first thing that we do is to build a proper rapport with the patient.
Yeah.
So same thing you have to implement at the time of OET speaking. That is really important.
Yeah.
Okay.
I think the clinical communication criteria easily can connect with the nurses or
any profession, any healthcare professions.
Because you are already done with the certain kind of situation in your clinics. And what about the second criteria then?
So second criteria is understanding and incorporating the patient's perspective. That is what we have just discussed, because we are talking to a patient or a bystander. They will have concerns, or they will have their own point of view for some cases or some instances.
That's why they are with us, right?
Yes. So we have to understand those patient perspective, and which is very necessary to build up the conversation. So just imagine that a patient is bringing up a concern, but we are not meeting that particular concern, or we just keep on speaking any other thing. So our organization, the whole organization gets disturbed.
Yeah.
Yes. So that is the importance of understanding and incorporating the patient's perspective. So it means the mark depends on how fully we involve the patient or the interlocutor in our speaking.
Yeah. Then about the third one is providing structure. So like if you're saying about the providing structure, we have certain tasks. Maybe it's kind of 3 or 4, 5 or 6 something. You really can't skip a task and move on to others.
Yes. So just imagine that we are discussing regarding a disease condition. So we will begin with its etiology or its causes, then its diagnosis, then its symptoms, and finally to management. Same thing that we do in a care plan.
They just think that if you're dealing with the management first, so how can we connect the rest of the task?
Then the whole structure gets disturbed.
Yeah.
So you should go according to the task or according to the structure. Okay.
So that's all about the providing structures. I think we are really clear with that particular criteria.
But I would also like to add one more point, because in case of providing structure, so when we are discussing regarding the
treatment,
regarding the etiology,
the
first, and if the patient is asking regarding the management, then the point is that definitely we have to answer his question.
Yeah, right. Give the priority to the patient or whom you are talking to.
Yes. So that is the importance of providing structure.
And the next one is information gathering, and we can really connect with that.
Yes.
Because this is all about our task, and I think that the students are not struggling with this task, right?
Yes.
Because we have already a written format or written things to be said. So you can reveal with that. You can go ahead with that.
Yes.
So this is about the information gathering, and you have to ask the question. That's all about the follow-up question.
Yes. So information gathering consists of certain questions that we ask to the patient in order to get the information from their side.
Yeah.
So there are mainly 2 types of questions that we can ask.
Yeah.
So there are open-ended questions and closed-ended questions. So what are open-ended open-ended questions?
Yeah, if you have a certain task to ask, like the why the patient, the find out the reason for the visit, something like that. So you can ask like, can you tell your child's condition in detail, please? So it's like open-ended question.
Yes. Then coming to close-ended questions.
So have you had a history of smoking?
Yes, so that yes or no.
Yes or no.
So the answer will be just yes or no.
Yeah.
So which means that the close-ended questions will have a sudden pause after the answer.
Yes.
So just take care that you should ask more open-ended questions. So why should we ask more open-ended questions? Because that is what we have already told. We have to keep on our conversation alive.
Yeah.
So that is why we are asking open-ended questions.
So the last one is information giving. Information giving that I already mentioned before that we have a structures or we have some kind of bulletins to be given.
Yes.
Or we have to perform it. So that's all about the information giving, and try to give all the information, but there are some tasks we have to given from our own words, right?
Yes.
So if we will come into detail about the tips, so we can mention over that.
Yes.
If you are not well known about a particular task you have to speak out, there are some kind of tips to deal with that.
Yes. So I know that information giving is also very clear to you, because since it is a clinical communication criteria.
And most of the students have a concern, Alvin sir, that if we have given some kind of treatment management or management or some kind of disease, if they are not well known, will the score is gonna affect?
No, because that is not gonna be affected, because what is our subtest? Our subtest is speaking. So we are not attending a medical examination or something like that. We are just attending a speaking subtest. So the thing depends on how we present something rather than its credibility. Yes, credibility of course matters, but rather than the credibility, the point of difference is that how we present the things, or how we are able to communicate with the patient.
Yeah, right. And I just want to mention one point. That's why I put forward this kind of topic over right now, because in linguistic criteria, all the criteria having the score is 6.
Yes.
The total score is dealing with 6, and clinical communication criteria, the total score is up to 3.
Yes. So the linguistic criteria is more important, right?
Which is your speaking skill, language skill.
Yes. But we have to meet almost all the criteria of both linguistic and clinical communication criteria, so that we can get a good score.
Yeah. Then only you can deal with your B grade.
Yes.
And
So Varna ma'am, so I have a doubt. So do we have the provision to write on our role play cards?
That's a relevant question, because most of the students have this concern.
Yes.
We have the right to write anything in your role card, because it's your space. So do you want to add anything?
Not yet, because it is clearly understood that you can add anything, or you can write anything on your cue card or on your role play card, and just remember that you just write your name of the patient on the role play card, because it has a more chance that you may forget the name of the patient meanwhile you are speaking. So just note down the name of the patient in your role play card. Okay, all this comes under tips and strategies. So you can just note down these things, because we are speaking all the things, and at the time when we remember any tips and strategies, we are just saying it now. Okay.
If you're using the name, it's a tip that we are hiring right over here.
Yes.
If you're while our conversation, if you are using the patient name in between, it's a really favoring thing. The patient or the bystander is getting to feel that you are really listening them.
Yes.
Okay, you are really understanding them.
Yes.
That's why we are hiring to use the name of the particular person in between the task.
Okay. So, ma'am, do we need to maintain eye contact with the interlocutor?
Yes, sure, we have to. Doesn't mean that you really can't look into your cue card, but if you're just imagine, if you're talking with a person, if you're maintaining the eye contact, definitely you will gain a confidence to speak out.
Yes.
And moreover that, your interlocutor or your trainer or the patient will listen to you, and he will be or she will be actively participating in that.
Yes. So this is completely upon you guys, because we don't have a proper criteria regarding eye contact and all. So if you don't need to give an eye contact, then definitely you can concentrate on your role play cards, because we know that our voice or our sound is being recorded and it is being sent to the assessors.
Yes.
So it is not that much necessary to maintain the eye contact at the time of OET speaking, because the interlocutor to whom we are speaking does not have much role in assessing our speaking.
Yeah, you are right, Alvin sir. So I think we are done with our criteria.
Yes, so these are the main criteria for OET speaking, and I think it's clear with that. So if you have any doubts, you can just post your doubts in the comment box.
I think we can give a time for them to look out the...
Yes, I will just spare a few seconds for your doubts. So if you have any doubts, the comment box is wide open for you.
Yeah.
So please post it in the comment box and we will try to answer your questions.
You can really hire your comments and your questions or doubts over here, and we are here to help you.
So Josna, is it necessary to introduce them with Mr. or Mrs. or Ms. During a role play? So is it necessary?
No.
So it
actually
is,
no need.
Yes, it is not necessary to introduce them with Mr. For example, Mr. X or anything like that. Just call their name.
Yeah, that's totally fine to hear your name only.
Yes, so it's not necessary to introduce them with Mr. or Mrs. So Sia, when we have to ask the name of the patient if not given. So this is a good question. So this the answer of this question depends upon the type of role play that we are presenting. So our main challenge before beginning the role play is that we have to distinguish between a known case and an unknown case. Okay, so if in case of a known case or it is a known setting, then what we have to do?
If it is a non-setting, like more probably with the hospital ward, it will be a non-setting. So you can freely continue begin the task, because you are well known about the patient. So begin the task in a very friendly way.
Yes. So if you are doing a non-case, please note that you have to ask the name of the patient to the interlocutor at the time of preparation. So that is the thing that you have to keep in mind for non-case. Okay. So for the unknown case, so we are not aware about the patient. So for the unknown case, you can just start your role play as usual. So you can introduce yourself and you can just ask the name of the patient, or how can I call you, or for better communication, may I know your name please, as a formal setting, only for unknown cases. Okay, so I hope it is understood. Then how to maintain fluency. So how to maintain fluency?
Actually, I can share. Shall I share one of my personal experience regarding that?
Yes, please.
If the student is struggling with the fluency, I do have a suggestion. Try to go with mirror exercise.
Yes.
Because just take a topic. It could be your warm-up sessions, or it could be any role play, or it could be anything that you would like to speak out. And stand in front of a mirror and just try to speak out, and try to bring certain kind of expressions, and try to use your hands. And definitely you can avoid the humming. You get the perfect fluency. I'm not telling that you're gonna gain in a week. You have to practice. You have to practice a lot.
Yes.
And this is a better way to improve your fluency.
Yes.
And try to use your use your phone calls or anything. Try to be in English.
Yes.
Okay.
Yes. So we will continue with the clearing the doubts after a while. So we will definitely answer your questions. So just we will move on with our topic. So next we will be moving to warm-up questions.
Yeah.
Okay, so what about warm-up questions? Is it really important to answer the warm-up question with correct efficiency?
Yes, Alvin sir, because before the role play, we have warm-up session, and it is just to make you so comfortable.
Yes.
Yeah, we are dealing with like it's a formal or informal kind of conversation. Just believe in that, and we have to perform our warm-up in a better way. Then only you can be confident in your role play performance.
Yes. So the OET says that they are not assessing the warm-up questions, but
we are not sure.
We are not pretty sure about that. So the thing is that not worry about anything. Just answer your warm-up questions properly.
Yeah.
Yes. So we will just discuss 2 or 3 commonly seen warm-up questions and its answers. Okay.
So the main one or the one that I chose as in the warm-up question is about the professional background.
Yes. So, could you tell me regarding your professional background?
Yeah, sure. If the question is shooted to my side, I'm gonna answer like I'm a nurse by profession. I do have 6 months of experience in surgical ward of so and so hospital.
Yes. So this is what you have to say when the professional background is being asked. So first of all, you have to mention your profession, that which she has already mentioned. I am a nurse by profession. Then regarding your academics, I mean, I have completed my degree in nursing from this and this hospital, anything it is, and I have 6 months or 1 year, 2 year, anything of experience in particular, whether it is a critical care department, emergency department, anything of this hospital.
Okay.
Okay, so this is how we have to speak about your professional background.
Yeah, then I will show the second question, shall I?
Yes.
Yeah, recent course you have attended.
Yes, so this is also a question, warm-up question, which is commonly seen regarding the recent courses that we have attended. So all of you have may have your own answers. So that is what we wanted in warm-up question. So everyone has your own answers. So we can say I have recently attended a course on IV cannulation or a BLS, ACLS, anything. Okay.
But try to find something regarding the advantages of that course.
Yes. So if it is,
what do you gain from that course?
Yes, if it is regarding a BLS, then from that course I was able to get or capture more knowledge regarding how to save a person's life in the time of an emergency. So this is, so likewise you must be able to add some more points which is related to the course that you have attended. If it is regarding IV cannulation, then just add few. I was able to study more regarding the procedures for cannulation or something like that.
Yeah.
Yes. So again, it is highly personalized.
Yeah. Then okay, what is the best thing in your profession?
So this is also another warm-up question. What is the best thing in your profession? Again, the answers will be very different according to your perspective and your concept. So you can say, according to my perspective, the best thing in my profession is that I mean, I have a greater opportunity to provide love, care and compassion to the others. So that is, I think that is the best thing in my profession. So that is my perspective.
And if coming to my side, I just have only one statement. I can be reason for someone's smile.
Yes. So likewise, you may have different answers. So the thing is that at the time of warm-up questions, just make on your points, just organize your points and make a sentence. You have to make, and we know that we can prepare our answers for the warm-up questions earlier. So just try to prepare it without grammatical mistakes. Yes, because we are preparing it earlier.
And like most of the warm-up question, you can really connect with your side and just should answer. That's it. So one more is one more warm up.
Yes. So is nursing a choice or a chance? So this is also another warm up question. Is nursing a choice or a chance? So again, answers will be according to your choice. Then please.
For me, the answer will be nursing is my choice, because I fell in love with love with caring someone. So what I really mentioned earlier, if I can be a reason for someone's smile, I felt that it's a divine thing.
Yes.
So that's why I chose nursing. Sorry.
Yes. So again, I have one more commonly seen warm-up question. So why did you choose OET? Okay, why did you choose OET? So many students have many answers to say why did they choose OET. So they say that it was their childhood dream to work as a registered nurse in the European countries. Then an English proficiency test is really mandatory to work as a registered nurse. They have many reasons, but the important reasons they forget, because OET has a close resemblance to our profession, or OET is closely related to healthcare professions. Okay, not only nursing, we know that OET is meant for 13 or 14 professions. So we can say that OET is more profession oriented, that is to healthcare professionals. So please say this point as your first answer. And also, rather than saying European countries, you can say English speaking countries, because we know that all means European countries do not accept OET scores, so you can say English speaking countries. Okay. And also, when your dream destination is being asked, please don't say that my dream destination is UK. Just say my dream destination is the United Kingdom. Okay, so this is also a
common mistake.
Yes, that you guys normally make. Anyone. Yes. So we
I
will
think
have.
we can wrap up with the warm-up.
Yes. So we will just have a look at the comment box.
See, there is a question from Punu. Is really important to complete the full task? If you are stopping, if the time is up to the 5 instead of 6 tasks, will our score gonna reduce?
This is a common question that everyone has there in mind. So it is not mandatory to complete all of your task, but you have to speak up to 5 minutes. Okay, so you have I already told that it is a conversation, so it should have a sense of completion. It should have a it should feel like a conversation. So it is not necessary or not mandatory to complete all our tasks. Okay, then along with that, if you are not able to perform in a nice way in one role play, then also your score is not gonna affect much, because you have another role play following by. Okay.
Just think about a second chance.
Yes, because the OET officials have said that they value their they will hear both the role plays, and they will give an average mark to both the role plays. Okay.
OET is giving so much opportunity and concerns in OET speaking, like about the scoring, or like we are assessing the 2 role plays, right?
Yes. Okay, so Priya, could we suggest a name before starting the role play? So commonly we are not doing, or we are not practicing the same, but it depends upon the interlocutor, because I have heard that in some areas interlocutor, when we ask the name, or when we ask the interlocutor like how will we address the patient, then the interlocutor says that you can call him some name that we like. Okay, for in such instances, then you can suggest a name by yourself. Okay, but that is not necessarily needed. You can just ask the name to the interlocutor. Okay. Then so Sarah ma'am, please share the tips for improving the voice modulation. So how will we improve our voice modulation? So this is the main thing. So just consider yourself as a nurse. Okay, so we all are nurses, or I mean according to your profession, just consider yourself as a nurse, and your voice modulation will automatically come, because the nurses, you know, the nurses have a good voice modulation, and they know how to keep their voices up and down. So just consider yourself as a nurse while you are speaking, and your voice modulation will automatically come.
And please do make sure that you are really understood with the settings. I say always says to my students that if you are reading the settings, like if you are reading the settings in an imaginary way, you can really connect what's really happening, and the settings really expose the rhythm of the scene. I always like to mention the task as a scene, then we can enact, right? We can perform as a scene play or role play.
So what she said is really correct and really useful. So be oriented to the task and the setting.
So the voice modulation not gonna be a difficult task for you guys.
So how we convince the patient if a patient or relative is very reluctant? There might be chances that the patient or relative is very reluctant, or else they are not satisfied with the care that we provide. So for the instance, if a patient arises a complaint, if a patient arises a complaint regarding the care or regarding the inconvenience that they have faced, then the first thing that you have to do is that you have to apologize.
You can say that I really apologize for our mistake.
Or the inconveniences you have faced. So the first thing is that you have to apologize. And again, if the patient is not accepting, then you just keep on providing more and more reassurances, and keep on providing more, be calm, or try to make the patient more relaxed.
And don't stuck in a task if the patient is so reluctant. Don't try to force the patient to follow your instruction. Try to respect their opinion. If the patient is too reluctant, you can say that I really respect your opinion and skip on to this next task. Okay.
Yes.
Otherwise, you really can't complete the task.
Yes.
There are role plays, there are settings. The patient or the bystander is throughout reluctant.
Yes. So, Tina, hi sir, Mr. or Mrs. is important while speaking to the interlocutor. So, we have already done with that question. So, it is not necessary to introduce them with Mr. or Mrs. Just call their name. Okay.
Yeah, just call the name.
Yes.
I think the question is repeatedly asked.
Yes. So, is there any other doubts?
Like Ponu is again asking that is the two role play is assessing different different examiners.
Yes.
So that's already Alvin sir mentioned here. Two role plays are assessed by different people. So we are not really not known about that, but two will be assessed.
Yes.
Okay.
Both of your role plays will be assessed individually. Okay.
Okay.
Then anything else?
I think we done with the
yes. So if
comments.
you have any doubts or inquiries regarding warm-up questions also, please do post it in the comment box and we will answer it. Okay.
Okay.
So let's move on with the tips and strategies for OET speaking.
Alvin sir, I think we are done with some of the tips and tricks.
Yes, we have covered almost all the tips and tricks.
Yeah.
Okay. So one of the main important trick is that you will get a role play card and you have the provision to write anything that you like on a role play card. Okay, so that is the thing that you have to keep in your mind. You can add your reassuring words, follow-up questions, anything in the role play card.
Yeah.
So that is the most important tip or trick. Okay.
And the most tip or trick I would like to mention that I already mentioned just before, that read the settings. Please be concentrated while you are reading the setting, because the total settings give you a brief idea regarding the role play. It could give an idea whether it is a reluctant patient or the bystander, all about the scene or what's the rhythm of that.
Yes.
Okay.
So may I interrupt you?
Yeah, sure.
So we have a doubt from Priya. If you forget the patient's name in between speaking task, could we ask again? So that is what I have just we have just already said. So if you have a chance to forget the name of the patient, then you can write the name of the patient on your role play card.
Just think that if you are dealing with a real life situation, you forget the patient name and you are really asking the patient name again.
That's not good,
fair, right? It's not sounds really great. So better to write the name of the patient firstly in the role card.
Yes. So then coming to speaking, we have certain steps to follow, or we have 6 steps that we usually do at the time of speaking. Okay, the first thing is briefly introduce yourself according to the scenario. So self introduction is really important at the time of speaking.
That's why we are giving a priority to the introduction part. If you're messing with the introduction, the entire role play gonna in a wrong way.
Yes. So if it is our emergency department, so if it is an emergency department, then definitely you will be an emergency department nurse or emergency nurse or a fast responder, anything.
Yeah.
Okay. So
no need of elaborating your introduction.
Yes.
Just precise and shut up with the intro.
Yes. So will you please give me an introduction for emergency setting?
Yeah, sure. If it is an emergency setting that you are dealing with a patient reluctant because of you made a delay over there.
Yes.
You can straightly start like, I'm Varna, registered nurse in the emergency department.
Yes. So that is
how
enough.
may I help you?
Yes.
Or how can you can go with that itself.
Yeah, okay. So many students have a doubt regarding the kind of introduction that they could use at the time of home visits, because we have seen that many students keep on asking many questions at the time of home visits. So how will we introduce or how will we begin a home visit?
We can ask like, is this John's home? Is this the right time to speak out?
Yes, just 2 questions is
that's
necessary.
Certainly,
okay.
Because it's already known that you are going to a particular person's home. So in the 3-minute preparation, you can ask the name, and after that, you just ask only 2 questions. Is this John's home? And is this the right time to speak? Okay. No need of asking is the right person.
Yes. So the thing is that just ask a maximum of 2 questions, and the questions you can select, because they have many choices of questions. Am I talking to Mr. John? Is the right time to talk? Is this Mr. John's house? Yes.
May I get in? Those are
Please
things.
don't ask such so many questions. Just finish it in 2 questions.
Yeah.
Okay. Then
Savita, I have a question that is there is necessary to ask concerns every explanation in every task.
Yes, it
Sometimes,
depends. Yes, it
sometimes depends. If some depends on the task, we have to shoot a question like a follow-up question or concerns, worries.
Yes,
yeah.
so I think it is good to ask a follow-up question after the completion of each and every task, because that can also increase our patient
And try to
participation.
use different follow-up questions.
Yes,
right?
yes.
Avoid repetitions.
Avoid repeating the follow-up questions, and I hope that you have a set of follow-up questions in
Yeah.
your hand. So
Yeah.
please do use different kind of follow-up questions, and if you need, you can add or you can write those follow-up questions in your role play card so that you will not forget that.
Yeah, right.
You can use different, and also same with reassuring words also.
Yeah.
Please please use different kind of reassuring words.
Yeah.
Okay, so that is the regarding introduction. So then coming to so before that, how will we introduce our patient in a non-case?
Yeah, in a non-case, I will give an idea. Like if it's in a hospital ward, the patient is your patient.
Yes.
So you can begin like if the just think that the patient name is John.
Yes.
Hi John, I'm Varna. How was your day so far? You can begin as a more friendly way.
Yes.
That's the introduction what I give in my role, please.
Yes. So the thing is that you must be able to distinguish between a known case and unknown case, because and that is easy too, because from the role play card itself it is really understandable, right?
Yeah, there is a question or comment raised by a student, Jasmet. Is the speaking test is on the same day or another day? We are conducting four modules in the same day itself.
And in the speaking subtest will be conducted in the afternoon session.
Yeah.
So most probably it is in the same day, and if someone inconveniences or something occurs,
Yeah.
then sometimes in very rare cases it might be postponed to the very next day. Okay.
But probably it's on the same day,
Same day.
4 modules.
Yes. So please tell introduction in different scenario. Yes, we have just dealt with that.
Yeah.
So that is regarding the introduction. So the second step that we have to do at the time of speaking is ask questions.
Yeah.
Yes. So you keep on asking questions,
Yeah.
because we have to one of our criteria was understanding and incorporating the patient's perspective.
Yeah.
So we will only get the patient perspective if we ask questions.
Yeah.
Yes.
And I just want to mention that is like, shall I ask a question, Alvin sir?
Yes. Yes.
So if you are dealing with a bystander or a parent, what a name or whose name should be asked?
Yes, so this is also a common question that many of our students ask.
Yeah.
So if a two person come to us, or
Yeah.
if a mother and child come, so just ask the name of the patient. I mean not of the patient. Sorry, just ask the name of the person to whom we are speaking. Okay, just we no need to ask the name of the mother and name of the child and any all of them. If you are talking to, or if you are speaking to the mother, just ask the name of the mother.
Yeah.
Yes, so that's not needed.
Otherwise, the thing you are gonna confuse with the names, or the subject gonna be changed.
Yes, because now we are not going to speak with the child.
Yeah.
We are going to speak with the mother. So that is only needed.
Only needed.
Yes.
And
Is there any
how
other
can
one?
we understand whether it is a known or unknown case?
So that again depends upon
The scenario.
yes, and also regarding the scenario, because as we said, most probably all the home visits will be known cases. Yes.
And emergency department depends on emergency. Like mostly 80% will be unknown case.
Yes. So
But
in emergency department, if a patient has been admitted overnight in the hospital in
Yeah.
the emergency department, and just imagine that you are the morning shift nurse, then that patient might be unknown to you.
Yeah.
So that again
depends on the
yes.
scenario. But hospital ward probability for as a non-case.
Non-case, because-
And like in clinics, outpatient clinics, could be a chance. Mostly it will be unknown.
Yes.
And that's why we are requesting to read the settings clearly.
Yes.
And from the settings, it is well written that whether it is a known or unknown case.
Yes.
So Alvin sir, if it is given that just examined in the scenario,
Yes.
so how can we begin the task?
Yes, so that is again a common question.
Yes,
so you just imagine that you have a question like you have just completed the examination of so and so. Then you have to begin your role play like, thank you
Yeah,
for
thank
allowing
you.
me to examine your feed. I mean anything.
Yeah.
Okay, so you have to begin with thanking. They are thanking
John or
yeah.
someone so and so for allowing me to assess your wound or
Anything.
or something else.
Okay.
So
Then the next one is respond carefully to the patient's responses. Okay, so the patient may have many concerns, or the patient may have many complaints, so we have to respond carefully to that.
Okay, yeah. And Reshma have a question. Can we ask additional questioning apart from the task? Okay, sometimes like as I said, if in a non-case, we can begin there, like how was your day so far, or did you had your food, something like that. No need of asking too much questions. And if depends on the task, if there is only 3 bulletins or three tasks, you have to manage the time, right?
Yes.
So you can ask, you can fill the time with certain questions.
Yes, because it is according to your role play card. So if you feel that there are only fewer points to say, then definitely you can add points by your own.
Yeah.
But if you think that there are many things to, or there are many tasks to complete, then there is I will not appreciate to give up things from your own, because our time is also really important.
Yeah.
So the fourth one is provide an explanation of the condition and respond to further questions and concerns. I think it does not need much explanations.
Yeah.
So followed by advice and reassurance and conclusion. So conclusion. So we should have a proper conclusion to our role play. So how will we conclude our role play?
Depends on the scenario, sir. Like there are some type of mistaken, like everyone have a studied by heart some kind of conclusion, like thank you for the cooperation or something, and wish you a speedy recovery. And it is you are wishing the mom or the parents wish you a speedy recovery. So we can't use the conclusion
because we have a tendency to by heart each and everything, reassuring words, follow-up questions, conclusion, everything. So if the mother has come to you with the problem of her child, then please don't tell the mother that I wish you a speedy recovery.
Just you can say I wish a speedy recovery for your son.
Yeah, I wish your son a speedy recovery. Anything. Okay, so be oriented to what you are saying.
Yeah. And I think that there is not a structured conclusion according to the scenario. Like being a nurse, how you gonna conclude or how you gonna say bye to the patient?
Yes,
it depends on you. You can create anything over there. You can speak out with that, but make sure that you are not speaking any grammatical error over there.
Yeah. So again, conclusion depends upon yourselves. So that is regarding the 6 steps that you have to follow at the time of speaking. So is there anything else?
Please explain how to deal with brackets task. Okay, the points which is written in the brackets.
Yes, so that is not a much. That is not a big thing. Yeah, because all those tasks which is or the points which is given in the bracket is for helping us.
Yes, and maybe if 7 or 6 bulletins, and if it's so subtask in the brackets, just make sure that you are gone through the task. Like make the points or the words in a sentence. And just shoot up.
Yes.
If you're explaining it, you're gonna lose your time.
Yeah.
So time management is really
just
important.
Construct a proper sentence and just speak it out.
Yeah, that's totally fine.
Yes. So so if you face any problems, so rather than our OET speaking, if you face any problem in your general speaking, the only way to overcome that is to keep speaking and speaking. Okay,
that's the only easiest and the only way to improve yourself. Just speak out.
Yeah, just try to make your casual talks in English.
Yeah,
that is really good.
Just break the shell and come out and speak out.
Yes, so you have to be confident. Okay, so just imagine that you are, you got panic at the time of examination. I mean, you forget the reassurance words. You forget the follow-up questions. That doesn't matter. Please be confident and you should have a good clarity in your sound.
Yeah.
Then definitely you have a good chance to get a B grade.
Yeah, sure.
So you have to be confident about the things that you are going to present.
Yes, exactly. And confidence is you're really going to reflect in your entire role play and your scores.
Okay, so Priya, sir, I got a small card for only 2 or 3 tasks, but we have still time to finish. So by that time, how could we finish? So that is what we just said. If you get a small role play card or a role play card with fewer points, then you can add points from your own.
Yeah.
Yes. So that is importance of linguistic criteria also. So we should be able to speak properly, or we should be able to speak in an open wide manner. So you can add points from yourselves.
And there is a question from the Rishma side. Is the questions in the bracket want to ask separately or in a sentence?
No, the task is same, right? Yeah, it is also all those points are really given to help for us to complete the task.
Yeah, but in sometimes like the first task will be find out, and it is find out the reason for the visit or something about the find out about the pain, and the brackets it is given as onset, frequency, the treatment you have given.
Yes.
So if you have to perform lots of tasks, 6 or 7, and from the role play it is very clear that it's a kind of time challenging.
Yes.
So what to do is you can freely ask the parent or the patient, can you, for getting better picture, can you explain your condition in detail?
Yes.
And be a good listener. If the patient is skipping or the trainer or the interlocutor is skipping any of the task in the brackets, you can shoot up with that.
Yes.
So
Any other
anything
doubts?
else? So can you please list down the 6 steps? Just list down.
Yes, yeah, I will just list down the 6 steps. So the first one is just a sec.
So there is one more question is our introduction is assessing. Definitely it's assessing, because introduction will reveal that whether you are known with the task or the criteria about the
Yes.
settings. Because if you wrongly introduce or begin the task instead of known case, you are presenting as unknown, the entire task gonna be in a wrong way. So
Yes.
definitely it is assessing.
Yes, so the 6 steps are: briefly introduce yourself according to the scenario. Briefly introduce yourself according to the scenario. Then the second one is ask questions. Ask questions. Then the third one is respond carefully to the patient's
Okay.
responses. Then fourth one is provide an explanation of the condition and respond to further questions and concerns. The fifth one is advice and reassurance, and the sixth one is conclusion.
Okay, Alvin sir, there is a question which is I've really skipped. What or which words should be avoided in speaking?
Yes, so we just forget that.
Yeah.
So which all
Thank you
words-
for remembering us.
Yes, so which all words that we have to avoid at the time of speaking?
Yeah, we really have don't have any right to compel the patient.
Yes.
We just have only right to request or suggest or advise.
Yes.
Okay, instead of should, like we have we can avoid the words should, must,
Yes.
have to.
Yes.
Okay, instead of that you can I'm recommending, advising, suggesting.
Yes,
It is better to.
It should not feel like a command, like
Yeah.
we are commanding the patient.
We are just hiring a better option
Yes.
rather than this. Like it is better to. So these are the way words we are using instead of these 3 words.
Yes. So is there any other queries?
No, I think no. We are done with almost all.
So we'll just wait for a couple of seconds.
It is important to see interlocutor's face.
No, it is not important to maintain an eye contact or to watch the interlocutor's face, because we are doing our speaking subtest and it is completely upon us. So we can it's not necessary to maintain eye contact. Okay.
And Sajida have a question is if reassurance words repeated can be asked repeatedly. Please make sure that you really have a lot of reassurance phrases, right?
Yes.
So try to learn 3 or 4 and avoid repetitions.
Yes.
It is a better way.
Yes. So thank you for allowing me to assess your wound in this case. Is it necessary to introduce ourselves?
If the just examined case,
Yes.
you can, if it is just examined, you can say that thank you for allowing me to assess your wound.
Yes. So we will just now move on with our role play. So we will just display our role play card on the screen.
Yeah.
So I hope our role play card is visible with you. So if you find any problems in the visibility, please do comment. Okay, so now you'll be seeing our role play card. So you can see that. I hope you can read the same. So we will just begin with nurse, because that is what we have to do.
So shall I read the settings? Or?
Yes, you please read the setting.
Okay, I will read out the settings. The setting is emergency department at Children's Hospital, and the nurse, a 3-year-old boy, has been brought to the hospital suffering from chest tightness, wheezing and dyspnea. You suspect the child has asthma. The parent is anxious and become agitated with. The child is awaiting to see a doctor. You are the nurse taking care of the child's vital signs. I'm sorry.
So regarding the task?
So the task, the first one, explain to the parent that emergency department has been busy, and as soon as the doctor become available, he or she will be over to see the child.
Yes. So next one is ask the parent to briefly explain his or her child's condition.
And the next one, explain what the doctor will do. In brackets, it's given that provide a diagnosis after a thorough medical assessment, etc.
Yes.
And the next one, reassure the parent that you are doing everything possible to take care of your child who is stable. A doctor will attend shortly.
Yes.
And the next one, encourage the parent to relax and to allow you to attend to the child. And the last one, explain that you need to continue taking the vital signs.
Yes. So this is the all about the task. So is this a known case or an unknown case?
Actually, we have taken this because it is really confusing. It's an unknown case.
Yes. So will you please justify your impression on this?
Yeah, sure. Because I came to conclusion that this is a unknown case because it's an emergency department, and we are dealing with a child's parent.
Yes.
And from the statement, from the settings, it is very clear that the parent is anxious because the doctor hasn't, or no one is taken care of her child.
Yes.
So definitely it's gonna be a unknown case.
Yes, she has been left unnoticed for an hour.
Yeah.
Yes.
So we are the first one who are gonna take care of the child.
Yes.
So definitely it is very clear that it is an unknown case.
Yes. So I hope the task is clear, and shall we begin with the role play?
Yeah, sure, we can.
Yes. Okay.
So we are giving a demo regarding these settings. So we are starting over here. Okay. I'm Varna, registered nurse in this emergency department. May I know the reason for your visit, please?
Nurse, I have been waiting here for an hour, and I was being left unnoticed. So I want to see the doctor immediately because I'm here for my son. So I don't have enough time to spare for you.
Oh, I'm really sorry, and I really apologize for the inconvenience that we caused. For better communication, may I know your name, please?
I'm Sarah.
Okay, Sarah, could you briefly explain what brings you here today?
Nurse, as I already told, I have no much time to explain all those things with you. The thing is that I have to consult the doctor immediately. So please make a provision for consultation.
Okay, sure, Sarah.
Because I have been left unnoticed here for the past 1 hour. And
okay, I'm so sorry for the inconvenience. Sarah, you are here for your child, am I right?
Yes.
So your child is dealing with some kind of difficulties. So could you please explain to me what she is dealing with, because then only I can proceed the further treatment plan.
Yes. So my son, he's 3 years old, and he's suffering from chest tightness, wheezing, and difficulty in breathing. So as a mother, I'm really anxious and concerned about his condition, and I really fear that he might have a chance for asthma. So I'm really concerned on that.
Sarah, your worries are really understandable. Being a mother, I can really connect to your emotions. But don't worry, you are in the safe hands, and you will not feel any delay in the procedures. Okay, so shall I deal with that?
Nurse, so if you know that my son is suffering from asthma, then please confirm it to me, because I am really concerned.
See, nurse, I'm not the authorized person to deal with that. The doctor will come soon, and he will give a diagnosis after the thorough examination. Is that okay for you?
Yes.
Okay.
But
So,
I want to see the doctor immediately.
yeah, sure, Sarah, we will arrange it. And don't worry, we are doing our best for your son to deal with his condition. So please do cooperate with us. I do
Yes.
expect that.
Yeah, if it is really necessary, then I will give my cooperation. Yeah.
Okay, do you have any concerns?
Not really, nurse.
Okay, so try to be relaxed. Being a mother, you have to give. It is better to be with your son,
Yes.
and if you are really worrying, it's gonna give a bothering to him.
Yes.
So try to not to worry, and you are with us. We really have a expertise panel over here.
Yes.
We're gonna take care of your son very soon.
Yes.
So shall I ask a permission for the treatment?
So you are saying that you have to do some kind of assessment on my child?
Yeah, sure. Because it is very mandatory to take a vital signs right now. Then only we can assess what is stability rate.
Yes. So yeah, please you can go on with that.
I'm very thankful you, Sarah, for allowing me, and thank you for your cooperation.
Yes. So this is a demo. This was a demo for this role play card. I mean setting. So this is how you should do the speaking sub test. So you have to prepare for your reassuring words and follow up questions. So I hope it is clear. And so that is, I think we have done with our all
Speaking.
the topic. Yes. So if you have any kind of doubts, please come and post it in the comment box. We'll just wait for a couple of seconds. I mean, couple of minutes.
Okay, that's not.
So can we use the same reassurance in one and second role play?
Yeah, no, there is no issues at all, because there are two different settings, and assessed by maybe are gonna be assessed by two different people. So no issues of using the same reassurance in the same role plays.
Yes.
I mean different role plays.
Yes. So if you don't have further questions, so we'll be winding up. So again, if you have any doubts, you can post in the comment box, and definitely we'll try to answer in the comment section. So thank you. So I hope everyone is clear with the speaking sub test. So thank you for watching.
Yeah, thank you everyone.